Today, the UN warned that 3.5 million children in Pakistan are at risk for waterborne diseases in the coming days as floodwaters continue to wreak havoc throughout the country. The World Health Organization is asking the Pakistani government to investigate a reported case of cholera over the weekend, and a UN official said a second wave of deaths could be approaching. Aid agencies are struggling to reach people cut off by harsh weather in order to distribute critical food, water, and medical services to the more than 2 million who are now homeless. Pakistan's government estimates that 20 million, or 1 in 10 Pakistanis, are affected by the disaster. For more details, we're joined by Sonia Walia, Regional Coordinator for Asia at the International Medical Corps. That's an international humanitarian organization. She's directing relief efforts in Pakistan and joins us from Washington, D.C. Welcome to FSRN.
Thank you.
How is the situation on the ground in Pakistan different today than last week?
Well, today, actually right now today, what we're seeing is for the next 3 days, there are no rains forecasted. So the water's starting to recede a little and dry out. And what that means in terms of health is that we're going to start to see more disease, more watery diarrhea, more acute respiratory infections, and more skin diseases. So that's actually what we're looking at now for the coming days and this week ahead.
As you gain access to these areas, are there medical centers, are there hospitals that are able to operate there? Are you finding any of that intact at all?
Very few. In that region, there are a lot of community-based healthcare centers, and many of those are just flooded, and all the supplies have been ruined, including medicines and medical supplies. So now, just recently, we've been able to access some of those basic health units, and what we hope to do is support the government in rehabilitating those basic health units. So all our teams are made up of national staff, and they really know the lay of the land, and so they're looking very carefully at how they can gain access to those areas that are cut off.
Today, the UN is warning that 3.5 million children and infants are at risk over the next, in the near future, because of waterborne diseases. How are children particularly vulnerable in this kind of situation?
Well, their immune systems are not as built up as ours, and especially with health and hygiene, they may not have access to clean water, and may not be able to wash their hands before they eat and things like that. They're, in a situation where they're in crowded areas, which fosters quick transfer of disease between people. And really because of their age and their lack of a very strong immune system, that they're more susceptible to these diseases.
Well, in addition to services of physical health and preventing disease, your teams are in Peshawar, Charsada, Swat, and other areas, and they've been offering psychological help as well. What are they hearing from people and children in those areas?
They're really hearing a lot of their people are very down on the situation. I mean, as I mentioned before, they were displaced before because of conflict, and now they're displaced again because of natural disaster. They've lost their things twice within the period of less than a year. We've seen a lot of children that have been affected with what we call acute stress disorder at this time. We've been counseling a boy every day individually who watched his mother drowned when he was rescued, and this was a boy of 8 years old. So these are the things we're seeing, and we're trying to make sure that we're able to provide these services, and we're trying to make sure that people are aware that this service is needed.
Your organization has been in Pakistan since 1984, and people in parts of that country, as you were talking about, have been dealing with conflict, dealing with being displaced even before these floods hit. How does this crisis compare to your work over the past 2.5 decades there?
I would say that this is the most devastating crisis that we've seen. It's just affected so many people, and although the lives lost may be less than some of the other disasters we've seen this year, it has affected over 20 million people, and they've lost so much. And, it's very hard for people to be resilient year after year. So we're really, hoping that people are understanding the impact that this is taking on the people of Pakistan.
Sonia Walia is the regional coordinator for International Medical Corps. She's directing relief efforts for the group in Pakistan for this ongoing disaster of floods and displacement of millions. Thank you for joining us.
Thank you.